Welcome back to the Gillett Health podcast. I'm Dr. Kyle Gillett. This is where we give you the tools to develop a balanced approach to health. This episode is a bit different, mini episode, if you will. We're going to be talking about overrated and underrated supplements. And by overrated, we mean they're overrated for the indication that they're generally used for. That doesn't necessarily mean we don't like them. Some of my favorite supplements are probably overrated, and some supplements that I really don't use or like a lot are underrated. So for simplicity, if you can see this red would mean overrated, and this green would mean underrated.
The funny thing is, looking in the camera,
can't really see that.
Can't see it at all.
Yeah,
so I think these are out.
We might not use those. So,
I just looked. I was like,
Somewhere in between. This was and this is our initial reaction. So David does not know what I'm going to ask him. And then when you ask me about medications, I will also not know. So it's our initial impression. A lot of times it's easy to say, oh, well, in between, it depends. So this was a way that we were going to try to make ourselves put our nickel down on overrated or underrated.
Yeah.
We'll just do our best to delineate. So I figured what better way to figure out overrated or underrated supplements by the Amazon most popular supplements. They have a couple categories. They have weight loss. They have diet, sports, and nutrition. And we'll just go category by category. So the first is by weight loss. Number one is the Dr. Tobias Colon Cleanse for weight loss. It has psyllium husk and senna.
oh my gosh.
So by weight loss, does that mean they're trying to lose body weight? Or by weight loss, to me, that means they're trying to lose body fat.
Yes. To me, weight loss is body fat loss. So way overrated. Way overrated. Like not even close. Yes.
Why is that? You'll lose weight if you take a bunch of laxatives.
Absolutely. You have to wake up and poop success,
Number two is a blender bottle. So I don't get that one. Number three, apple cider vinegar gummies.
Underrated? I like apple cider vinegar for sure. As for weight loss, overrated. Overrated. I forgot that they were marketing it for weight loss. Yeah. Overrated.
It says formulated to support weight loss efforts.
No.
So underrated supplement, but that is infuriating that it says formulated to support weight loss efforts. Next, an Atkins protein meal bar.
Overrated.
Next. A meal bar is kind of a little bit of a non sequitur. Anyway, a bar is not a meal, by the way. It can replace a meal, but it's not a meal. Next one is Oxygen Digestive System Cleanser Capsules.
Overrated.
I have never heard of
another cleansing supplement.
Oh, way overrated. I agree. Oh, man, this is a rough list.
Gosh.
Next, another oxygen cleanser. That's the same.
Okay.
The next one, Orlistat. This is interesting because this one has had some huge swings.
I'm still going with overrated. I mean, I'm very keen on what works and what doesn't for weight loss from an actual relative and a clinical perspective. Overrated.
The way I see Orlistat is it does work. It's not fantastic. There's a lot of better options for something. And Orlistat is also a prescription. They have Xenical, which is like an extended release Orlistat, which you don't want to take it for a long period of time. But for the right patient, it definitely has good efficacy, but it has a lot of side effects. So a lot of fatty stools is the main side effect, like floating, diarrhea, and gastric distress. But if you have not a ton of fat consumption, then I guess it's an extra incentive for that. 5-10 years ago, way overrated because everybody was on it. Now, apparently there is a decent amount of people on it, but there is way fewer people on this just because everybody gets their GLP-1 at a med spa now.
Yeah. I mean, GLP-1, I would have a stance on that too.
Yeah. Anyway, that's an interesting one. The next one is a thermogenic fat burner, and they do not say even one of the ingredients on the front. So let's go to the back.
Yeah. Take a tally list. And it's going to be a blend, of course.
270 mgs caffeine.
Oh, okay.
700 mgs L-carnitine as a weight loss supplement. Okay. 450 of green tea, presumably with EGCG, but they don't say if it is. And then Capsamax, and then BioPurine, because every supplement has to have that for bioavailability, right?
Sure. I'd say underrated. That's actually, I don't know if I would have the dosing definitely differently, probably lower on the caffeine, increase on the green tea extract for sure. And then, yeah, I think that's an effective weight loss supplement, fat loss supplement.
A bit better than just drinking enough black coffee to total 300 mg of caffeine.
Yes.
So if the price is certainly higher than it, but yeah, definitely better efficacy than that.
Yeah.
And it's usually not drinking 300 mg of caffeine in black coffee or that. It's like drinking 700 mg of caffeine from coffee and espresso or that. So in that case, I would say that's objectively a better option, but any stimulant, of course, is not going to be side effect free. Next is probiotic strains with green tea and cayenne.
Oh, man.
Weight management probiotics.
Overrated.
Overrated. Yep, for sure. Slim Fast protein shake.
Overrated.
NAC.
Ooh.
That might be not categorized right.
Sure.
N-acetylcysteine.
NAC is probably hands down one of the best supplements out there.
That's why they tried to make it a medication. It was too good to be a supplement. So they tried to ban it.
Crazy enough. So, however, there are some potential effects that could actually help with fat loss, downstream effects more so. So I would just say, just because it's such a good supplement that it's underrated.
I like it. I think it's just mischaracterized as a weight loss supplement. So this this next one is a very interesting, I guess, the other side of the spectrum from the probiotic for weight loss, a broad spectrum prebiotic and soluble dietary fiber for weight loss.
Amazing for weight loss as from a dietary standpoint. However, as far as fat loss goes, overrated.
Okay. I think that's fair. From a health standpoint, like you mentioned, 90% of Americans do not get enough fiber. And if you stack multiple types of fiber together, then that can be particularly helpful. So, yeah.
From that standpoint, it would be underrated, in my opinion, from overall health.
It does not make me angry in any way to see that in the list. Let's see. We'll do a couple more here in this list. Another apple cider vinegar. Another Atkins bar.
Man.
No, maybe that's about it from this list. There's another probiotic. Keto gummies. Keto supplements and keto in general. How about that? We just talked about this in our last podcast.
Yep. Overrated.
So when you go keto, you're going to lose, all your glycogen and all the water that follows the glycogen. So if you lose a pound of glycogen, then you lose 5 more pounds of water. So very common to see huge changes with that. So let's see. Endurance and energy.
Ooh.
I'm interested.
There's going to be a lot of caffeine on that list.
Electrolytes.
Oh, underrated. Sure. Why not?
I can go with that. Pretty popular now. There's a lot of these various startups like LMNT and many others for electrolytes, but I think that's good.
It's being popularized lately, but I still consider underrated. Oh gosh.
Aminoline, BCAA with natural caffeine.
I'm just going to go with overrated.
Yeah.
I have to.
That's a bit of a vestige of times past.
Yes.
And next one is a pre-workout with vitamin D, creatine, beta-alanine, and caffeine.
Sure. Okay. Underrated.
I'm good with that. Next one's the same thing. Okay, here's an interesting one. Maca root. Peruvian maca root. Specifically in the endurance and energy category.
Yeah, I would say overrated in that category in particular. Great supplement, overrated in that category.
Yep. Great supplement. Maca is also one of the supplements. This is a teaser for a future video in our list of supplements that we like with no well-characterized mechanism of action. So, bit of a teaser there. We'll
Looking
leave it
forward
at
to
that.
tuning in.
Organic honey.
Organic honey for endurance.
Yep, honey in a waffle form.
I think they're stretching a little bit there. I'll just go with underrated due to the fact that most people don't have enough carbs before they're going for exercise.
Yeah, I had not heard of that. Like I heard of things like UCAN or like beta cluster dextrin, like slow release carbs and Cliff Bars. Cliff Bars is the next one. How about that?
Overrated.
Yeah, very common. So again, a good supplement, but you know, if you're, by the way, good rule of thumb is if you're an elite cyclist or if you're like running marathons, if you're exercising for, let's say, more than 30 minutes, or certainly more than an hour, there's a good chance that if you were a high level athlete, then consuming good carbohydrate sources is going to be performance enhancing.
Yep, absolutely. It's the number one limiting factor for recovery in between playing your sport.
Here's a good one. A 100 count of caffeine tablets for $7 with free shipping.
That's an expensive caffeine supplement. Nah, actually, that's not that bad.
That's not too bad.
My effective dosage, in my opinion, for when you're talking about endurance sports and actually performance is going to be 100 milligrams to 200 milligrams of caffeine. So I think that's a fine dosage. Mm-hmm. And I would say underrated. People actually underrate how effective caffeine is for even from a cognition standpoint. So underrated. Sure.
Nice. Okay, this one is already, is triggering still a word? Can I say that?
Triggering, yes.
This one's already triggering me.
Oh, no.
Physician's choice, with choice all in caps, organic ashwagandha, 1950 mgs with black pepper extract, because every supplement has to have a huge amount of black pepper extract for bioavailability. For endurance.
So this is a weird one for me. So I'm going to go with overrated. However, if you have ashwagandha paired properly, the only response that they've seen with muscle soreness is a cortisol response, potentially. The only correlation, and it's not a science, it's a correlation. Mm-hmm. So ashwagandha can be awesome for cortisol response. However, you definitely want a cortisol response when you're doing a sport.
Yeah. Again, that one may have been mischaracterized. And with ashwagandha, I'd like to start with a lower dose and likely without the black pepper fruit extract. So this next one, I may be personally responsible slightly, along with friends for, I would say this supplement is no longer underrated for sure. So, and again, I didn't know what was coming up. It's interesting that it's for endurance. Oh, male performance and endurance. Okay, this is an interesting one. Solar Ray Tongkat Ali, 400 milligrams.
What? Why'd you popularize it so much? It used to be underrated. It's no longer underrated. Now I think it's actually almost leaning towards the overrated side of things more so than anything else. I think it's definitely overrated now.
Yeah, I mean, I have a hard time saying it's overrated, but it's not underrated.
Yeah, it's not underrated.
Literally everybody is talking about
it. Is a really, really good supplement.
I put it right in the middle. So this is one of the ones that I'm not going to choose a red or a green.
It used to be underrated.
Yeah.
Yes.
I would say part of the reason why it's no longer underrated is because people still don't understand the mechanism. It is likely a phytoandrogen, and it does upregulate steroidogenesis cascade enzymes, both adrenally and gonadally. So in both testes and in the ovary. But the initial data that it was a SERM or an aromatase inhibitor does not look very promising, especially in vivo, in both human and preclinical data. So anyway, we can move on from that. We've done lots of podcasts.
I don't even know if, like, from an endurance standpoint, an athletic standpoint, like using a SERM from that standpoint, if you're looking for muscle growth, like you wouldn't even really want that.
Yeah. Anyway, last one in this category, guarana, the natural herbal Brazilian caffeine source, I guess, but also probably pharmacodynamically active outside of caffeine.
Yeah, I would say that it's underrated because you can stack it with caffeine into the mix. Mm-hmm. It's just a different way of accomplishing a stimulatory effect for athletic performance. I'd
probably go to, like we mentioned earlier, probably go to things like EGCG or even dynamine before guarana. Mm-hmm. But because it's not super common. Yeah, I'd have to agree. Underrated. All right. Let's do another category. We could do sports nutrition, or we could do nutrition bars and drinks.
Oh gosh, stay away from bars and drinks because I'm going to roast everyone.
Okay, sports nutrition for 500.
There we go.
Or maybe how about we go to nutrition bars and drinks?
Okay.
They're all just going to be overrated.
They're all going to be overrated.
Okay,
every single one.
Let's not do that then. Never mind. We're going to sports nutrition.
Spoiler alert.
For 500. Okay, this one might be a bit easier. Hydrolyzed protein powder, whey.
It's actually way underrated. It used to be overrated. Now it's underrated. I'll give my protein is one of my 2 favorite supplements for performance.
Yeah, I think that is a reasonable outlook. Most people for like this is specifically for sports nutrition.
Yeah.
Well served by giving some protein in earlier on in the day. Next, Atkins bar again.
Overrated.
Keto friendly though. Still overrated.
There we go. Definitely overrated.
Keto friendly.
Yeah. These are carnivore friendly. Nice.
Ooh, these I actually like. Quest nutrition protein chips.
Oh, those are underrated. They're so good.
They're good.
No digestive distress. It's like one of the few protein things out there that I will actually eat. I have some at my house right now.
Yep. It's a guilty pleasure for sure.
Yes.
Anything crispy, cheesy. Oh, it's just
Have you had the taco ones?
I don't know. I'm not sure.
I'll
check them out.
They're really good. Those and the sour cream are really good.
I also like high protein, low sugar Pop-Tarts. I always like to give James that because give him crap about his Pop-Tart bulk.
That's so fun. Wait, is that what he's doing for his bulk?
No, he did that many years ago.
That's so funny.
He did a Pop-Tart bulk.
It
worked. He gained a lot of body weight. So.
Yeah, body weight. In the weight loss category, right? Versus weight gain category.
Certainly. So here we have another electrolyte powder. We already kind of talked about those.
Yeah, I think from a performance standpoint, from an athletic performance standpoint, I still consider them underrated even with them being popularized. I just think that you should be getting more sodium through your actual diet and not have to rely on drinking electrolytes during your sport. However, they're still underrated in my opinion.
Interested to get your view on this. Plant-based protein powder.
If I'm comparing it to a true pure whey isolate, it's way overrated. However, if you are a vegan on a vegan diet or a plant-based diet, it is way underrated. So it depends on the spectrum that you're looking at. So I'd consider it underrated because most likely the person that's going to be buying that is going to be vegan or plant-based and they need more protein, whole proteins.
Yeah, that makes sense. That's kind of a tough one because that's a polarizing topic. So, for some people it's probably overrated. For some people it's probably underrated. For me personally, people know that I like my plant-based protein plus collagen in the evening because less mTOR activation while I'm sleeping. But I guess to be fair, this is the sports and performance section. So not a true replacement. So for whey protein. Going on down, more electrolytes. There's tons of companies now that have electrolytes. I think LMNT calls their affiliates salt miners or something like that. Salt sellers, they have something funny. I just kind of like it. But.
So I was filming a video one time and I salt my food super heavily, especially when I'm dieting down. And I dropped a joke just saying it. I was like, salt is life. Well, I was really dieted down, so I was like a zombie anyways. And then they started making a meme out of me that salt is life.
Nice. The next one, I know that we've discussed this before, L-glutamine, apparently in the sports and performance section.
I would still consider it underrated. I think that L-glutamine is probably definitely a top 10 supplement, maybe almost a top 5 supplement, but you have to pair it with something to make it for performance basis, in my personal opinion.
Yeah. Really should be under the health section.
Yeah, I agree with that.
All right. Let's do one more. Let's find a good one. All right. Number 23, original BCAA powder. We already talked about this one too.
Overrated.
Yeah. I can't believe that this is Amazon's real most sold list. So Definitely a lot of disappointing things on there and definitely a lot of reassuring things.
I actually had a really interesting conversation with someone that owned a supplement company, and they still sell BCAAs due to the fact that it must have been the amount of money and marketing that went into BCAAs versus essential amino acids, which they're the same price usually, but I would lean into an EAA all day over BCAA.
Yeah, for sure. Definitely agree with that. Supplements are really interesting because, as we mentioned, there's ebbs and flows. So one supplement like Tomcat or Fedosia will be very underrated and then kind of swing back the other way. Another supplement that's done with, and I know we've talked about this before as well, is ecdysteroids, like beta ecdysterone. Yeah, I mean, obviously very overrated when they were getting all the hype and they were on Joe Rogan all the time. What's happening with those supplements recently? And I guess what's your view on niche use cases?
So if you're talking from an athletic performance standpoint, and especially like in the bodybuilding space, it's way overrated. I think that everyone's trying to squeeze everything out of their performance that they can. And my two favorite supplements, whey isolate and creatine. Creatine is the most underrated supplement. It used to be the most overrated supplement. It's the most underrated supplement, and not any special type of creatine. Creatine monohydrate. Save yourself the money. There's a lot more studies that point to it being the best form of creatine. However, ecdysteroids, I would not spend the money on. There's also a sourcing issue. That is another major issue with ecdysteroids. Until there's more clinical data and stuff like that comes out to pointing towards it, sure. I think if you're pathwaying maybe on a bio-individual level, there could be a used case for it. And I think you and I have had a conversation around that there may be a used case for it if you're pathwaying heavily down it's the beta estrogen receptor, right?
Yeah. The beta estradiol receptor, it certainly is an agonist at this receptor. And we know that in clinical data, it certainly leads to a higher amount of lean body mass, which is likely mostly just water that's pushed into the tissue. But if you think about a lot of performance enhancing compounds, like D-ball, a lot of the performance, and again, that's not necessarily a bodybuilding drug, it's more of a strength and powerlifting PED. And for some people that have very low estradiol, like someone who's a natural power lifter that's like dieting down to make a meet, if they take that, there's a couple things to take into account. They will likely be stronger, but they'll likely retain more water and more body weight, which might make it harder. So perhaps you take it in like a mega dose right after you make weight. That could be an interesting use case. My favorite candidate for this is a patient population that probably doesn't listen to a lot of more plates, more dates. Postmenopausal females with breast cancer that are on aromatase inhibitors that have rock bottom estradiol levels.
Sure.
They're great candidates for beta estradiol receptor agonists, given that the alpha estradiol receptor is in the breast tissue. And that's the one that you don't want to agonize. So theoretically, that could even help agonize beta estradiol receptor in bone and tissue like that. Just a good case of individualizing a supplement regimen.
Yeah. D-ball, I think, is just a garbage anabolic steroid. I think like there's so many.
Such a bodybuilder.
It's just bad. Like it's methylated estrogen essentially is all that it is. And like you have Anadrol, which I think is better, even from a strength perspective, in my personal opinion.
Not a health perspective, though.
Not a health perspective. I mean, D-ball isn't either, though.
Yeah, if you're comparing it, and we'll have a separate podcast talking about overrated or underrated synthetics, both estrogens, progestogens, and androgens. So tune into our After Hours podcast for that. Maybe we should just call it Gillett Health Unhinged or something else. But
that'd be awesome.
And type in the comments if you have a suggestion for what we call our After Hours non-clinical podcast, aimed mostly for entertainment. But that'll be a fun thing to dive into.
Yeah, so I get to ask you about the top medications now, right?
Yep, it is time. Welcome back to the second part of the Gillett Health mini podcast, where we give you tools to develop a balanced approach to health. I'm Dr. Kyle Gillett, and David is here to ask me about overrated and underrated medications.
Yeah, this is going to be fun. I've been actually waiting to do something like this with you for a few months now. So, Number one, these are the most prescribed drugs in 2022. Number one, vitamin D.
I'll say underrated.
I would 100% agree with you there.
Mm-hmm. There's a lot that we could get into with vitamin D and individuals who shouldn't be taking too much synthetic vitamin D, but in general, that is underrated.
Curious, if you prescribe someone vitamin D, what is usually the use case and the dosage that you would do it at?
It depends on how low the vitamin D level is. If I do load vitamin D, let's say their 25 hydroxy vitamin D level in the serum is 7. So that individual is certainly getting at least 50,000 units taken with fat, maybe even more than once a week. But a lot of times the day after that, they're taking at least 50,000 units, whether it's a prescription or whether it's a supplement.
Now, after that, if you still didn't see their vitamin D going up, would you check for methylation issues?
In my lab panels, people can see on our website, pretty much every lab is going to assess if they have methylation issues.
Cool.
So, yep. And renal issues as well, given that 25 hydroxy vitamin D, of course, needs to convert to 125 hydroxy vitamin D. And then a lot of times I check calcium and phosphorus. So the level of those two, along with the parathyroid hormone, will tell you a lot about your vitamin D cycle homeostasis.
Amoxicillin at number 2.
I'd say amoxicillin is underrated. It is very likely overprescribed, but underrated partly just because unless you have, I believe it's non-tippable or type B Haemophilus influenza, that is one of the ones that requires a higher dose of amoxicillin or augmentin. Augmentin is amoxicillin with clavulanic acid, which is the antibiotic most notorious for causing diarrhea. And not all infections, not all sinus infections require that amoxicillin with clavulanic acid. Often you do not need to include the clavulanic acid for beta-lactamase resistant bacteria right off the bat. If you're someone who's at risk of beta-lactamase resistant bacteria, and if you don't know, then ask your doctor if you are, then that would be a better case for amoxicillin.
Oh my gosh. Number 3, levothyroxine.
Levothyroxine, okay. Man, from the medical community, I guess levothyroxine is overrated. For anybody else, whether it's laymen, people in the fitness industry, anybody that is not a medical doctor or nurse practitioner, I would say levothyroxine is underrated, actually.
Sure. Okay.
But yeah, among medical doctors, levothyroxine, even just generic levothyroxine, just you have somebody that has no capability of producing thyroid hormone. Let's say they've had a total thyroidectomy. Even if that patient is not on any source of T3 whatsoever, whether it's Cytomel or desiccated thyroid, then they're probably a good candidate to consider one of the brand name thyroid hormones. That way you're not getting it from different manufacturers with different ingredients. They're absorbed very differently.
Yeah, I like that. Lisinopril.
Lisinopril is a bit overrated. It's not a bad medication, but ACE inhibitors do cause a bit more dysregulation of something called bradykinin, which is a cytokine. It can cause what's known as an ACE inhibitor-induced cough. So for a lot of individuals, ARBs might be better options. ARBs do have their own unique downsides as well. Lisinopril does have uses other than hypertension, like nephroprotection. For example, if someone has an ApoL1 polymorphism, or if someone has like mild CKD, then it can situationally be used. But it is very commonly prescribed, and pretty much everybody just defaults right to lisinopril. So a bit overrated.
So essentially, would you say underrated for heart disease though? Or still overrated because you lean into an ARB?
For heart disease, it's useful if you have hypertension, or if you're right on the borderline between pre-hypertension and hypertension. ACEs and ARBs aren't, a lot of people just kind of like want to be on an ACE or an ARB. These are blood pressure medicines, by the way, just because they've heard that it can prevent heart attacks and strokes. But its benefit preventing heart attacks and strokes is that it's going to control blood pressure. And then secondary to that, it's going to help with heart attack and stroke prevention.
Perfect.
So don't just jump on an ACE or an ARB. Even if you're on an androgen, and you have some RAS dysregulation that's expected. If you don't have even pre-hypertension, then you don't likely need to be on an ACE or an ARB.
You'll like this one. Number 5, ibuprofen.
Oh, overrated for sure. Yeah. Ibuprofen's an NSAID. It can cause gastric irritation. It can cause hepatic and renal damage as well. And it delays healing of collagen in ligaments and tendons. That being said, if you have an ache or a pain one time, then it's not unreasonable to take a single ibuprofen. But chronic NSAID use is kind of the same thing as like chronic steroid use, corticosteroid use in that case, where you should find another option.
Yeah, I think, isn't ibuprofen rated as the number 1 most dangerous drug in the world?
I wouldn't be surprised.
Number 6, amphetamine.
So amphetamines, that's like dextroamphetamine, levoamphetamine. Adderall is a mix of amphetamines. Number 6 in the world. I did not know it was so high.
I didn't know it was either.
Yeah.
Kind of caught me off guard.
I suppose I'd say overrated because almost everybody who has ADHD gets put on this. There's so many other options other than Adderall, including non-pharmacologic options, but there's a lot of other pharmacologic options. And the incidence of comorbidities like tendency to have OCPD, which is OCD type symptoms, but not debilitating, or tendency to be like hypersomnolent or hypersympathetic, which is hyper fight or flight. There's a lot of other things to keep in mind. A pretty high incidence of sleep disorders like sleep apnea in adult ADHD. So there's a lot of other options. Again, it's not a bad medication, but it's hard not to call something overrated when it's a top 10 prescribed med.
Oh, I'm going to butcher this one. Amlodipine.
Amlodipines, this is a calcium channel blocker. I kind of think of it as in a similar category of lisinopril. Calcium channel blockers, in general, are one of the go-to more first-line medications for those who have hypertension or high blood pressure. Amlodipine is also nice because individuals who have Raynaud's phenomenon, that's kind of cold fingertips and toes, they turn purple and white or red. Amlodipine can also help with that. And then individuals with certain ethnic backgrounds, like African Americans, can benefit from calcium channel blockers more than they can in general for hypertensive purposes with amlodipine. So can I say neither? It's neither overrated nor underrated. It's reasonable to use as a first-line therapy. Let's say slightly overrated because I see a lot of men on TRT that are on amlodipine as monotherapy. And that's usually not addressing the root cause of the hypertension. Okay. If you have hypertension and you're on TRT, so you have a high, presumably a mid to high normal steady state of androgen, you're going to have dysregulation of your renin angiotensin aldosterone system, known as RAS. And for that, your root cause medication would be an ACE or an ARB.
Cool. I was kind of surprised by this one. Albuterol.
Albuterol. So I guess albuterol is underrated. Albuterol is most commonly used in inhaled format. So ProAir's a generic albuterol inhaler, and individuals with asthma or respiratory disease or COPD use inhaled beta agonists. I suppose I could say underrated. I remember my friend Derek, he has a More Plates, More Dates channel, made a video about the soccer team with Liverpool. And I think it was something like more than 50% of soccer players that played for Liverpool happened to have asthma and happened to be on albuterol of some sort. So albuterol is certainly a performance enhancing drug. But that being said, I guess you could make the case that if you have bronchoconstriction or bronchospasm, then albuterol is kind of just leveling the playing field anyway. So underrated.
Cool. All right. Ooh. Prednisone.
Prednisone's probably overrated. What's the joke in dermatology? If you have a lesion or a rash, then, you either try an antibiotic or a steroid. And then if it doesn't work, then start the one that you didn't do initially and then see if it works. So that being said, there are certainly cases of using prednisone. For example, if you have terrible poison ivy or toxicodendron, in your eyes and in your face and everywhere else, then, and you know it's just going to get way, way worse, then starting a, something like a 21-day steroid taper is very reasonable. If you have an inflammatory arthritis, then certainly, maybe that's a case where an NSAID, like let's say you have a newly diagnosed inflammatory arthritis, whether it's rheumatoid or whether it is psoriatic arthritis, some sort of inflammatory autoimmune related arthritis, usually antibody positive. In that case, some people will recommend essentially injected glucocorticoid like prednisone for months. So maybe in that case, an NSAID is a less harm option than that. But a lot of times, let's say you have a severe COPD exacerbation or you have really severe croup in a pediatric child, the downside of not prescribing a glucocorticoid, even a short course, is going to be less than the upside of preventing a hospitalization.
Sure, that makes complete sense.
Good rule of thumb, by the way, both for glucocorticoids, which are like prednisone, dexamethasone, methylprednisolone, which is Medrol. People hear about like Medrol dose packs, or empiric antibiotics. So those are, amoxicillin, augmentin, doxycycline, certainly fluoroquinolones. These are really supposed to be used as last resort. Unfortunately, we have a lot of people who are not particularly healthy in our healthcare system. Just look at how many people are admitted to a hospital in an average year. Like the average person is admitted to a hospital much more than you'd think over the course of 1 year. Those medications are of last resort, which means they are used to prevent hospitalization or used during hospitalization. That being said, most people get prescribed those medicines when they're in walk-in clinics.
Prednisone is one of the harder drugs to recover someone from if they have been on it for long-term use, from personal experience. Especially women on a hormonal standpoint, the hormone dysfunction that comes from it has always been pretty brutal to recover from. So, cool. Let's see. We're on number 10. Oh, I'd be curious on this one. Gabapentin. I didn't realize it was number 10. That's high up.
Yeah, that does seem pretty high. I think it's underrated because there's a lot of indications other than neuropathic pain that you can use it for. So you can use it for muscle spasm. You can use it for individuals trying to help wean off benzodiazepines like Xanax or Ativan that they're on chronically, or Klonopin. You can also use it as an adjunct to other pain therapies. If you have pain or an injury, for example, a back injury to where there is some component of poor sleep or insomnia or spasms, then you can add on gabapentin and the requirement for pain medication will go significantly down. Even something like a kidney stone where they're also feeling that their back is spasming as well, or it's shooting in different areas, you can add on an adjunct to gabapentin. There's been a lot of studies done on opioid prescribing, and an adjunct of gabapentin, if it seems like a reasonable addition, can significantly decrease the total morphine equivalence over a certain period of time. So, and also in Europe, they use gabapentin by the way, the brand name for that is Neurontin, but they use gabapentin for alcohol withdrawal to decrease withdrawal seizures. So there's a lot of different uses for gabapentin. It is technically an anti-epileptic as well, so it can be useful as an add-on for people with epilepsy. Underrated.
Yeah, I like that one. I never used gabapentin until coming out of my discs recti surgery, and it was a conjunction of a few different pain, I guess, killers, so to say, but they avoided complete opioids, and I will say it was the most painful surgery I ever recovered from, but the pain while I was on it was basically null and void. The issue is when they cut through you have nerves that have to heal, and that's so gabapentin was a unique one for me. So now curious, gabapentin versus NSAIDs, ibuprofen. Let's do ibuprofen since that was on the list. Where would you rate them, and what would you lean into? Either one of those.
If it was an injury where inflammation is at play, for example, let's say you have a bit of lateral epicondylitis. You're playing pickleball and you take 200 mgs of ibuprofen and it kind of just like instantly knocks it out. Then that's going to work a bit better than gabapentin. But in general, if somebody needs to be on a medication for chronic use, gabapentin is likely going to have less adverse effects. By the way, you do seem like one of the few male individuals who would have a lot of sympathy for females that have had a C-section, because a repair of diastasis recti kind of reminds me of recovery from a cesarean.
Diastasis recti was brutal to recover from. I will say the surgery was well worth it. I only had a 1-finger gap. However, whenever I would go to hug someone, I would actually feel it hit out through the diastasis. Even though I had a 6-pack, I had an 8-pack when I was on stage every single time, and no one would know that I had it. However, I could feel it internally more so than anything else. Yeah. My surgery went really well. I recovered from it. The nerve endings took like 8 months to heal from it though. And I was sleeping on a couch sideways for 2 months afterwards. So diastasis recti is a unique one. And women out there, by the way, after you guys do go through pregnancy, start healing it ASAP once the doctor clears you, because healing it afterwards, after several months, is probably not going to happen and it's going to require surgery. So
yeah, I like that you can kind of talk about that from a first-ish hand experience. It's kind of interesting.
I can't say I've ever been through pregnancy, but I did have
a surgery similar to a cesarean.
Very true. And I did have an epidural when I was 17. So I'm like halfway to pregnancy, I guess.
Nice.
All right. Let's go into number 11. Benzonatate.
Benzonatate. So Tessalon or Tessalon pearls. So right. This is a type of alpha antagonist, I believe, in the CNS that can suppress the cough reflex. I didn't know that it was so commonly prescribed, but you don't want to have zero coughing because you want to clear your some degree of mucus. But at the same time, a lot of times if you get prescribed this, you're just coughing too much and to the point where it can affect your sleep. So let's say you take it before you sleep. That's an underrated medication.
Curious, have you ever had someone that has coughed so hard over time that they broke a rib?
Yes.
Okay, because I've actually broken a rib by coughing so hard one time. So it's not the most fun of situations. And there's nothing that you can do about it. Just suck it up and...
Correct. Incentive spirometry and try to not get a pneumonia. Yep. It's not really helping the rib pain, but that's what you do.
Speaking of pain, mental depression, Xanax.
Xanax, I guess we'll have to say overrated just because it's prescribed so often. That being said, if someone has like a panic disorder for flying and they can't step foot on an airplane, then there's probably too much of a stigma against Xanax or benzodiazepines. It is good that the public is more well aware of the side effects of chronic heavy GABA agonist use of any sort, including Xanax and other benzodiazepines.
Sure. So you're going with overrated.
Overrated.
Okay. Agreed. Man, I'm going to butcher some of these. Fexmid. I'm going to go with some of the pharmaceutical names instead. It's easier for me to pronounce. Cyclobenzaprine.
Yeah. So this is Flexeril. So cyclobenzaprine.
Okay.
Yeah. I guess I'd say, I suppose this is kind of similar to a category of gabapentin, where there is other uses where you can use cyclobenzaprine. It's kind of the go-to muscle relaxer for urgent care docs and walk-in clinic docs. And for a patient that's having, let's say, like back muscle spasms or whatnot, it can make a profound difference. And maybe that's the difference between them wanting a script for a more powerful pain med that can potentially be, has induced physiologic dependence. So I'll say underrated.
Okay. So I'm actually going to add some input in here from the performance standpoint. So Flexeril, from a performance standpoint and a rehabilitation standpoint, is much more effective for rehabbing any type of injury, especially disc injuries where you have compression of the discs, to relax the muscles, to truly rehab the muscles so that you don't have to rely on I hate hearing about back surgeries. Now, the technology is coming really far, so I'm not trying to put it down, but when you have a compressed disc and a herniated disc, you can definitely heal them. And you need to unlock the muscles and rehab that area. And Flexeril is a drug that is extremely efficient at allowing you to at least start to rehab it. So, all right. Azithromycin, Z-Pak.
Yeah, so azithromycin is a macrolide antibiotic. It is great at what it is good at. So by the way, it's an anti-inflammatory. So if you have an inflammatory viral infection and you take a Z-Pak, You'll feel better. There are not many intracellular causes of bacterial sinusitis. So azithromycin or any macrolide for sinusitis, way overrated. For an intracellular bacterial infection, let's say you have something odd like a mycobacterium, and then it is underrated.
So curious, could you give us some examples, just in layman's terms, of different bacteria that you would use it for, where it would be underrated, and then certain instances where it'd be overrated? Just more popular viruses or bacterias. Well, bacterias, I guess.
Yeah, certainly. So a lot of respiratory infections have intracellular causes. So like Mycobacterium pneumoniae, Mycobacterium kansasi, Helicobacter pylori. That's not it's not really an intracellular bacteria. It's a spirochete. But macrolides are often part of a cocktail or a triple or quad therapy for H. pylori. Some gut infections, some infections that like are resistant to other things like chlamydia. Azithromycin can work quite well for, or doxycycline. There's other intracellular bacteria like listeria, but depending on where you are, there's one emerging cause of infection called Mycobacterium genitalium, mycoplasm genitalium, mycoplasm G. And on paper, because it's intracellular, you think that azithromycin would be excellent. In the southeast of the United States and then also Asia, and like different places epidemiologically have much higher rates of resistant mycoplasm genitalium, but it can be a particularly hard one to eradicate. I include it on all my general health screen STI panels. So every 1 to 2 years, every individual who is really probably everybody is sexually active unless they have the same partner and they've both been screened. And, let's say that they've been exclusive to each other for 10 years. Yeah, at that point, no need to keep screening for STIs. But for most individuals, say between the ages of 18 and 40, very reasonable to get that just with your routine labs. At some point, I should post my panel on my website.
Yeah, I think that's a really good idea.
Not to order though. Have your own doctor order it. But this is just the stuff that I order.
The number one prescribed antibiotic at my college was a Z-Pak.
So, fun fact: if you're positive for chlamydia, and even if you're negative for Neisseria gonorrhea, that's obviously gonorrhea, then often you co-treat. And also, if it's a college student, most of the times you do a single dose of 2 grams, because if you forget to take the other ones, then that's what leads to antibiotic resistance. That's why some strains of gonorrhea are resistant to multiple antibiotics, even Rocephin. Rocephin is a 3rd generation cephalosporin, also known as ceftriaxone, which is usually used to co-treat. So yeah, now I guess in most college towns, the urgent care stack of 2 grams of azithromycin one time and a intramuscular injection of Rocephin or ceftriaxone. They keep increasing the dose to kind of try to overcome the resistance. So it's gone up from like 250 to 500, 750. But anyway, that's kind of the go-to stack these days.
Interesting. Yeah, that was always like, I knew the go-to was always one day or like one serving of like a Z-Pak. And that was like the number one prescribed thing at my school, like overall. And weirdly enough, this is when opioids, I think, were a different classification of drug. I think it went up by the time I was graduating college, and cough syrup.
By the way, STIs like that is one of the cases where the physician can and should co-treat the partner. In general, they need to have like a chart and whatever record. That way they're just not kind of like randomly sending medications. But it's and partners too. So any partner that could have been exposed since the last negative test, you co-treat all those partners empirically, and you can just send the meds without a visit. So that's a public health intervention that is not done as often as it should.
I didn't realize that was a thing. I thought they would have to go into the clinic to do it.
That's what most clinics have you do, because you get a copay. Whereas if you co-treat partners, you're digging through like 2 or 3 different charts and doing all that work for free. But I'm just the messenger. So that's all I'll say about that.
Very cool. I didn't know that was a thing. Where are we at now? That was a Z-Pak. All right, Lipitor.
Lipitor, I'd say among physicians, Lipitor is overrated. Among By the way, Lipitor is a statin. It's atorvastatin. It's one of the oldest statins. It is lipophilic, so non-hydrophilic. It's not one of my go-tos, mainly because I like rosuvastatin's properties better. But it can be a high-dose statin. Statins have kind of been demonized. That being said, if you start a high-dose statin, which is Lipitor 40 or 80 milligrams, or rosuvastatin 20 or 40 milligrams, it has great data on secondary prevention. So if you've had a heart attack or a stroke before, it can be quite good for stabilizing any plaque that might be in various arteries, like the carotid or the coronaries. That being said, I think there's better choices most of the time, and there's a whole lot of generic lipid meds. So,
Yes.
Among physicians, a bit overrated, maybe in the populace, a bit underrated. Kind of hard to say. One interesting case where atorvastatin is definitely underrated: brain tumors, including benign brain tumors, because it is lipophilic. Then it is theoretically a lot better than non-lipophilic statins because it's going to get into those tissues and lead to less cell turnover.
Very interesting. All right. We're on to, I actually didn't ever know the generic name for this. Cetirizine or Zyrtec, which is number 16.
Yeah. Cetirizine or Zyrtec. I suppose it's one of my favorite antihistamines. So it is a non-drowsy antihistamine. It's not perfectly selective, but you have your H1 blocker, which is like cetirizine. You have your H2 blockers, which are like famotidine. And there is cases for this. You have your histamine 1, 2, 3 blockers, the third histamine channel. There's also agonists at it, like pitolisant, which is Wakix, which is a narcolepsy med or a hypersomnolence med. And then Benadryl, of course, blocks all three. I'd say it's really neither underrated or overrated. It's good at what it does, but if you're taking it all the time, then perhaps you should address some more of the root causes. There are people that just have strong genetic predispositions, but it's not necessarily like if you have a strong atopic and allergic predisposition through allergy season, it is reasonable to be on cetirizine throughout.
So there's a really good allergy relief medicine that's over the counter. It's called Allergy Relief System. It has quercetin, and I forgot what the other gel tablet is in it, but you can take it like 5 times a day and it really has no negative impact. And I live in Georgia where it's some of the worst allergies you can ever have. People are like, oh, I don't have allergies. They move down to Georgia and they're like, I can't breathe. So that has been amazingly effective for me, especially when I was doing the tiered Zyrtec a day and completely probably depleted my DAO.
Yeah,
so
that's certainly helpful. So addressing from multiple vectors rather than just hammering your high dose H1 blocker.